All right, hi everyone. It's Dr. Khosroabadi, and I'm thanking you for logging in and watching this live. This is actually my first live event on Instagram doing Q&A, so bear with me if there is any glitches. This is my first time. So far it's going so good. So we decided to do this to answer questions from patients who are currently looking for a bunion procedure, any kind of a foot surgery. But what I do mostly is my AMI bunion procedure, advanced minimally invasive bunion procedure, which is my own procedure. And then I also do a metatarsal lengthening two ways with external fixation and bone graft, which we'll have more sessions on those later. But hammer toes, bunionette, all those questions will be answered today based on what we got from our previous post that we did, and we got some questions ready that I'm going to answer live. And if there is any comments down here, I would like to answer those after I answer these questions. And feel free to type up a question, and we'll go from there. Saying hi to all the people who are waving at me. I'm waving at everybody. All right, so let's go with the first one. First person, should we say their name or no? Just keep it.
Good if you want.
Okay, Pantel Shad. She's one of our friends. Love you. I know her. So she's asking, how's my hair doing? So before I answer that, this was a general Q&A. So anything you guys want to know personal with my life, with all my projects, and also anything clinical or foot related, surgery related. So she's asking how my hair is doing. As you guys know, I've done a hair transplant about a month ago. Not this area, but my crown of my head. I went to Turkey and I got that done. And as a result, I ended up loving my short hair like this. So I'm keeping it short the way it is right now. And I've cut it twice already. So doing good. The first couple of months, the hair will fall out and then it'll grow back. So I will give you guys another update after 2 or 3 months once the hair starts growing back. But so far, so good. No pain. All the scars have gone away, and the hair is slowly growing back. So thanks for that question. We'll keep you posted. I'm also going to keep looking and see if there's any view requests. Do I do anything with that view request? Not yet. Okay. So our next question, I have my AV guy, my social media guy over here, Sako, who is behind everything that I do on social media. He's right here behind and helping me. So the next question from Steph Yem. Do you still use fixators, or all patients are bone graft candidates? Very good question. I'm glad you asked that question. Right now, for the past year and a half, I've been doing mostly bone grafting because I did external fixation for 12 years. I got good results. I had my own set of complications and obstacles that we all go through, all surgeons, when they change their system and their surgeries. So I started looking at another way of doing this because patients didn't want to be in external fixation for 4 to 5 months, sometimes 6, 7 months, because the bone wasn't healing. They had multiple pin track infections. They did not want to have something on their foot for this long. And I started looking at different things. And there came along one of my patients who is on the one of these chat rooms that she actually wanted me to do the bone graft on her. She said, I absolutely cannot have a fixator. I work at a bank and I don't want to have the fixator on. And I told her that I have done it, but not very often, and usually under 1 centimeter. I would do a bone grafting, or I would offer it to the patient. But with her, it was a 1.9 centimeter lengthening, and I told her all the complications that can occur with the bone grafting. And just like the external fixation, they both have their pros and cons. And at that point, she said, I'm up for it. I want to do it. Let's go for it. So I did my the longest lengthening with the bone graft on her 2 years ago. We did one foot and then the other foot. Results were amazing. She loved it. She never had to worry about pinstripe infection. She didn't have to worry about anything on her foot. And the best part of it is after the surgery is done in the operating room, 2 hours later, after I start, 2 hours later, the surgery is done and the bone is lengthened, the bone healing starts then. So that was another benefit, because with the external fixation, you go about 2 months of lengthening and then you stop the lengthening and the bone healing starts then. So there's almost half, the healing time is about half. So back to that question. Right now, I'm doing both, but most of my patients, when I explain to them the differences between the two, they always end up picking the bone grafting. So right now, I'm mostly doing bone grafting. If someone wants the external fixation, I'll still do that. I have great results with that, and I have a lot of experience, 12 years of experience with that. So hopefully that answered that question. All right, next question. How long will it take for me to go back to work after your Amy bunion procedure? Okay, this was from Vintage Apparel, LA. Thank you for using Amy, because that's my trademark procedure. So I'm glad you mentioned that. Amy is my advanced minimally invasive bunion procedure, my own procedure. So she's asking how long can you go back to work? So this is another great question. Depends on the patient's job or what they do for a living. Are we talking about sitting down, or are we talking about a cashier or a flight attendant that they're always on their feet? So it's two different things. If you have a desk job, you can go back literally in 2 to 3 days, because you can sit down and put your feet up, so there's not a lot of pressure on it. Not that you can't, you can do it. The problem becomes you'll end up having a lot of swelling. You're gonna have a lot of pain because of the swelling. So whenever we cut a bone, anyone that does this surgery, me or any surgeon, once the bone is cut or fractured, there's gonna be a lot of swelling, because that's how your body heals that area. So if you're standing and the blood pool is down, and with the gravity, you're gonna end up having a lot of swelling. So that brings more pain. So if you have a job that requires you to stand 8 hours a day, I recommend that you don't go to work for at least a good 4 weeks till the bone is halfway healed. Then you can start trying to see how that works when you go back to work. If you're lifting something again, same thing. So it all depends. If you have a desk job, if it's not very demanding that you have to stand on your foot, then you can go back within 2 to 3 days. I've had patients that go back to work. So that's that. She also had another question. I'm not sure if it's a she or he. I'm sorry if I'm assuming that it's a female. What sorts of exercises do you suggest I can do to straighten out my bunion? Okay, another great question. To be honest with you, I've been around and seen and felt and looked at so many different devices and heard about so many different exercises. None of them will basically take away your bunion. None of them. They will alleviate some of the pain, because if your toe is, jammed onto one side, or we call it sublocks, the devices can bring it back, so it alleviates the pressure of the joint being so crooked. So there are devices that help you do that, but I call it just like wearing glasses. I don't wear them anymore because I got LASIK. But like glasses, right? You put them on, you're able to see, and you take them off, you can't see. It's blurry. So these devices do the same thing. You wear them, you feel less pain because it aligns your joint better, but then they're bulky, they don't fit into your shoes. Even the toe spacers, they're very uncomfortable. So nothing on the devices that I could say it's gonna do anything for your bunion. As far as exercises, again, nothing. Once that tendon overpowers the other tendons and stretches the other tendons, and the joint is lopsided, so to say, there isn't any exercise that I know of can bring the bunion back. So if it's past a certain point, unfortunately, you can't do anything about it. So might as well just wait. Don't bother to buy anything. Don't bother to exercise every day because it's really not going to do much. Just wait for it to get worse. So you have pain or you're symptomatic, then you can come and get the surgeries done. Unfortunately, this is an hereditary issue, and it stays in the family. Sometimes it skips a generation, but there is not much you can do. Sometimes people ask me if it's a shoe that I wear and all that. Those things can exacerbate the problem, but will not create a bunion by itself. Okay, next question. How does a virtual consultation work? Good question. So the way I've been doing it for the past year and a half too, even before COVID, I was holding virtual consultations because I want to say about 65 to 70% of my patients come from out of state or out of the country. So I'm not able to physically see them, but what we do, our process, the way it works, we make sure we kind of vet our patients. We make sure we get their x-rays, we get the picture of their foot. Then once everything is done, we get a history from them. Everything is done prior scheduling of the virtual consultations. Once we get everything, and I look at everything and I feel like the patient is a good candidate for Amy Bunion procedure, then I will give the green light to my patient coordinator. She sets up a Zoom consultation. Then they have a Zoom consultation with me. I'm usually here in this room or maybe at home in my home office, and I go over the x-rays with the patient, and I can share my screen, go over any questions they have. I still can't physically examine them, which happens a day before surgery. I get a good feeling of what I'm dealing with. I sometimes have the patients move their toes and all that stuff. But a complete physical examination is always done prior to the surgery. So I have the patients fly in, usually about a couple of days before the surgery. So the day before surgery, they come in here, they get all the necessary tests done. I do a standing CT. All my patients get that. We'll do a video on that. It's a very informative test. So they get that. We check their circulation. We check their bones. We do a bone scan, make sure that they have good quality bone for the surgery. After that, I see them, examine them, answer any last minute questions they have. So Zoom consultation happens in this manner. So hopefully you got your answer, and I appreciate you guys listening. Thank you. Hi everybody. I see some people waving. Thanks for watching. Appreciate it. We're gonna be doing more of these, everyone. I'm gonna pick a day every month. Once a month, we're gonna do this. I'm gonna give you guys 30 minutes. You can come up with your questions here or send them directly to us prior so I can answer them. So we make it a monthly thing so that way I can answer any questions that you may have. Okay, so they're asking about the average cost of each surgery. So this is a kind of a loaded question because we can never tell you what the average cost is because I have to see the x-ray. There are times that the patient thinks they have one thing, but then they have multiple things. You know, it could be a bunion, it could be also a toe that's crooked. So there could be multiple things. I'm gonna take a sip of my coffee actually. I don't drink coffee, by the way. This is a decaf coffee. So I just want to make sure that because I've talked about drinking coffee before, and just making sure everyone knows this is a decaf coffee. One of my guys was visiting and he brought me a decaf coffee. Okay, cheers guys. Anyway, so it's almost impossible for me to say what the surgery would cost, you know, just telling me what you have, because you might not see what I see. So we go still through the same procedure, take x-rays, pictures, and I talk to the patients with via Zoom, and then from there we'll send you, if you don't have insurance, we'll send you a cost details of the cost of everything that's going to cost. For us, the way we do it, we put it all under one umbrella. We give you one price for patients who are cash or out of pocket. It covers all the visits, pre and after, the anesthesia, the surgery center facility, and my fee. Everything's all in one package. We didn't want to nickel and dime everyone. We're just doing all in one package. By the way, we are also In one of my videos, I mentioned that we take some of the proceeds of every single surgery that I do over here at Cutting Edge Surgical Institute, which is my institute. We take some of the proceeds and donate them to my Nepal mission trip. So if you're having surgery here, know that part of the proceeds goes to that. And at the end of the year, we'll announce how much we donated to that trip. So hopefully that helps the people in Nepal. I go there every year. We couldn't go last year, but we're planning on going this year if things calm down. So feel good about coming here and having the surgery done. It's we do some good work in Nepal. We'll show you guys what we do in there. I've been going there for about 7 years now. Okay, last question. What exercises do you suggest for rehabbing of a sprained ankle? Very good question. I know this guy because he's a good friend of mine from India, Mohammed. Well, how you doing, buddy? So I think he recently sprained his ankle. But yeah, exercises of sprained ankle would be definitely rotating your ankle around first. If it's an early stage, like basically you just sprained your ankle like 2 to 3 weeks ago, it's still healing, I would recommend just drawing the ABC with your foot, so that way you get all the ligaments and also all the tendons around involved. So do that a few times a day. This is early stage. And then once it heals a little better, I would definitely say toe raises, where you go and stand up on your toes and make sure you're close to a wall or inside a door frame, so that way you catch yourself if you falling or something, or you get pain. So going up on your toes is very good. And then also get one of these bands, elastic bands, and just pointing your toe down, and also putting the elastic band the other way and bringing the toe up. So those are good exercises. And then you can put the band around the foot just like you had it, and then go to the left and to the right. So you want to strengthen all the tendons around the ankle that are responsible to put your foot down, bring it up, and pull it to each side. So those are the ones that you want to. And icing. Honestly, icing is one of the best things you can do right after the injury. You want less inflammation. Less inflammation you have, the less pain, and hopefully the less. Hopefully your injury would be less. How would I say it? Less involved. I don't have the word right now. I can't. It's not coming to me. But basically, if you have an injury right now, if you ice it, just the fact that the process of icing decreases the inflammation, it lessens the injury to that area. So that's what I was trying to say. So icing, strengthening exercises, and then if your doctor or yourself pick up a shoe or a boot to wear, don't wear that more than 3 to 4 weeks. Wearing it more than 3 to 4 weeks, it actually hinders the healing, because you want to have some involvement of the tendons and the ligaments for the healing to occur. The first 2 to 3 weeks, it's good to immobilize, but after that, you want to start coming out of that. Don't make it to be a crutch, something that just prevents you from walking and bending. So don't use it as an immobilization for a long period of time. So that's what I would recommend for an ankle sprain injuries. These are new questions?
Yes.
Anything you can do to proactively keep your feet healthy? So this is an interesting question, because I'm a big advocate of being barefoot in the house. In the house. Not outside, because outside the terrain can be very dangerous with nails and rocks and sharp objects and stuff. But around the house, if you feel safe, like my kids, barefoot. Everybody barefoot, because you want to strengthen your tendons. You don't want to be in shoes all the time, because shoes prevent motion at some joints, and it prevents the involvement of all the neurosensory nerves and like the feedback mechanism that you get from the ground, from the sole of the foot. So I would definitely say barefoot in the house, unless you have OCD and you don't want to be barefoot. Other than that, I would definitely say, inspect your feet daily, especially diabetics. If you're diabetic and you don't have good sensation, I would definitely inspect your feet. Maybe even put a mirror on the bottom of your foot to make sure you can see it. If there is any cuts or anything maybe punctured your skin and you weren't even aware of it because your sensation is bad. So inspecting your feet, walking barefoot around the house, and then doing some exercises. The one I just mentioned about the ankle sprain, those are very good exercises. And nail polish is one thing I was going to talk to you guys about. Don't keep the nail polish on for like a year, like meaning not a year of same nail polish, but I'm saying you put one on, take it off, put another one on, take it off, put another one on. It's like your nail needs to breathe. So I would take it off, give it a day. Give it a day, let it breathe, and see some sunlight, maybe some air, something, because you don't want to keep it covered like that with nail polish all the time. So give it a day. So those are the things that comes to my mind right now. Nah, not much other than that. But if something else comes up, I'll definitely let you guys know on the next interview that we have. Why do you? Oh, okay. Well, this one is really not a question, but I'm going to read it. Why are you so cool? Doctors are not really cool and fun. LOL. Okay, thank you. I love you too. I'm trying my best. I think I'm just trying to be who I am and not really let my title define me as a person. It's just what I do for a living, but it's not really what who I am. Who I am is something different. You know what I mean? So what I do is this, what you do is different, but who we are as a person inside, we're all human, and we have our fun side, our sad part, we have our happy time, we have our let it go time, and just being with kids time and acting like a kid time. So I'm trying to live by that. So thank you for noticing, and I appreciate the comment. Next person, many doctors advise me to make the surgery as last choice. What's your advice? I agree. I think if you are not in pain and you don't have any symptoms, it's hard for you to justify why you went under the knife and had surgery, because you have to have a reason. There are people who are looking at this as a cosmetic thing, and they come to me, and once we go over everything and they understand everything, I still operate on them, because honestly, cosmetic, it's real. I mean, if it's something that's bothering you cosmetically, just like plastic surgeons, they operate on patients who have most often very little issues, breast augmentations, a nose job, the perfectly functioning nose, but they don't like the way it looks. So that has an effect on a patient's psyche, and maybe they get depressed and they don't feel confident, or whatever that may be. That individual has the right to feel that way, and that individual has the right to change it if she wants to. So I will go over everything with the patients, making them aware of all the complications that can happen from surgery and anesthesia and all that stuff, which is very rare, 5% maybe, but they're still there. So it becomes the patient's choice. I still operate on those patients. Last choice, I don't know. If that's something that feels right for you, that you wanted to have pain and be unbearable before you decide to go under the knife, then that's your choice. If you come to me and you present that you don't like the way your foot looks, you don't like the way your toe looks and all that stuff, then it's different. When it comes to insurance carriers and all that stuff, they don't pay for anything cosmetic. So we are very strict with that. If you are going through your insurance, then you have to have pain and you have to have symptoms. Otherwise, it's not covered by your insurance. I don't know any insurance that covers it. but you can still pay out of pocket and have it done because it's your right to do whatever you want to do with your body. So that's my answer to that question. Again, cost of each surgery, we went over that. Hopefully the person who wrote this question was online and was able to see it. Hi everybody. I wish I could read everybody's name here, but I love you guys for just logging in and listening. All right, so the next question, how much are virtual consultations and what made you get in this field? Okay, our virtual consultations, I can direct you to our patient care coordinator. I think, I don't know, we'll answer that questions in the email. If you send us an email, I will announce my email at the end, so that way you guys can take, or you can send us a private message on Instagram, we'll let you know. But as far as the second part of that question, what made you get into this field? This is a long answer, but I'm gonna shrink it down and tell you that I've always wanted to be a doctor. Why? My mom wanted me to be a doctor. I mean, I'm gonna be honest with you, it was put in my head since I was very little. But I definitely liked it too. I really wanted to help people, and I know that's a cliche answer, but I'm honestly living it. You know, going to Nepal, going to these underserved countries, and helping and doing things for the community. I've always been there for the community, and you know, right now I'm working on another trip to South Africa. I'm talking to a doctor, one of the rural areas in South Africa. We're going to set up a clinic there. So I definitely am very drawn to helping others. The best thing, they've done a study where the best thing that can give you happiness, a true happiness, it's to give back. Money doesn't do it. Cars, material stuff doesn't do it. The only thing that they have come up with, and this is actually a study, that makes people happy is the ability to give back or making others happy. So that's where I get my happiness, and my success comes from that. I feel successful because of that. So why I got into this field, I was honestly like trying to feel different fields and see what fits. I actually even looked into dentistry. I even took I think it's called DAT. But we had a friend who was a podiatrist, and it was my aunt's friend, and she said, why don't you go and spend some time in the summer, in one of the summers that I was off, with this guy and see if that's what you like. So, excuse me. So I went, and I really loved what he was doing. He was dealing with people's feet, which is very important. He was dealing with diabetics, with elderly patients, and you know, bunions, everything that comes with with foot injuries. And I was like, wow, this is like really cool. You get to be a dermatologist for the feet, and get to be a surgeon, like an orthopedic surgeon for the foot. You're doing diabetic wound care, so you're a wound specialist. It's like everything is all combined in the foot. And as a podiatrist or a foot doctor, we are the experts when it comes to foot and ankle. Like, there's no doubt about it. It's something that we've been studying, you know, in medical school and then in residency, and I did a fellowship in limb lengthening. So honestly, that's after I spending a summer with this doctor who's not in practice anymore. I kind of fell in love with it, and I felt that it was not too like crazy. Let's put it this way: like I don't have to be on call a lot, and the lifestyle was good. And I had everything that I wanted. I've always loved to work with my hand. And as you guys have watched my videos, I'm always doing a project at home, whether it's a treehouse project or a football field project or doing something around the house. So I like building things, and that comes from my dad. My dad was a handyman. We always did projects together growing up, and I get his genes and his drive. And he still helps me. Have you guys seen it on my videos? He's still out there helping me with my projects, and he's 80 years old. So I love working with my hands, and surgery was something that I fell in love with, especially bone surgery, and it's like second nature to me. So that's why I have come up with all these procedures, and I'm always trying to make them better and you know, more what do you call it, more forgot the word now. Anyways, try to always improve. That's what I'm trying to say. Improve on these procedures. So that's how I got into it, and then I just took the MCAT and applied, and I got into the New York school. I didn't even wait to get into any other school. I just accepted it, and I went. So that's what the story of my career started. Reading a question here, Dr. K, do you think the South Africa practice will start currently in Africa and would do not break you, doctor? Best news today. Oh, okay, yeah. So I guess this patient is from South Africa. Yeah. So when we go to South Africa, we'll be doing everything foot related. But what we have done in Nepal has mostly been pediatric patients, and we mostly do clubfoot, vertical talus. These are all the deformities that happens either at birth or close to at a very young age, maybe a year or two. So mostly our concentration is on treating children, and then if adults come and we don't have any pediatric to treat, then we always treat the adults. So we'll keep you guys posted with that South Africa trip that we're working on, and we haven't even set plans or anything. I'm talking to a doctor who does volunteer work over there. We want to see. I have to go scout it and see what abilities they have, what facilities they have, can we even operate in tents that they have and stuff like that. So it's going to be definitely more difficult than what we have set up in Nepal. But I'll keep you guys posted. Thanks for this question. I appreciate it. So the next question is, how young should you consider surgery for bunions? I guess she means how old do you have to be to qualify for having a bunion procedure. So for females, as soon as the growth plates are closed, they can have surgery, which means probably around age 15, 16 nowadays. Usually after the first menstrual cycle, the growth plates are starting to close because the females stop growing right after their first menstrual cycle. So probably around 15, 16, 17, I've operated on a 14-year-old who had her growth plates already closed. So as soon as the growth plates is closed, that's considered an adult bone, and we can operate on them, even though the age, it's still a minor, but we can operate on them but boys are different. Male, they can continue growing up to when they're 18, sometimes 19. The reports of some soldiers are still growing, like they've grown and like their boots size changes. They enter at 18, they're still growing. So men are different and women are definitely different. So hopefully that answered that questions. How long until you can bear weight with the boot after one-step surgery? So I think she is talking about the bone graft brachymetatarsus surgery. So with the bone graft, I don't let them bear weight the first 3 to 4 weeks. 4 weeks probably would be better, because we have stretched the bone, we put a bone graft in there and put plates and screws. We want to get some bone healing before you can put weight on it, even though you have plates and screws and a wire going through all the bones, keeping it very stable. But you still have to not put too much pressure till some of the bone healing happens and everything settles down. And then I'm still trying to work that out. Maybe I'll reduce it to 2 weeks. Right now it's at 4 weeks. As I mentioned to you guys, I'm an innovator. I'm always thinking outside the box. So I'm still trying to improve this one-step lengthening. This is something I don't know who does besides me. I know under 1 centimeter, a lot of doctors have done it, have attempted doing it, but what I'm doing is basically 1.9, 2 centimeter lengthenings, which is very rare to be done with the bone grafting. Being able to stretch the soft tissue that much, being able to not jam the joint when you're stretching, all that stuff has been resolved by my new techniques. Like I've figured all that out now. So, and that's thanks for my patients who come here and they accept what I'm doing and they allow me to modify it a little bit and solve some of the issues. Because recently I just came up with a joint spacer that I put in the joint, so when I'm lengthening the bone in one stage, the joint space still maintains. So I'm maintaining joint space, which is it's a discovery. It's big because we couldn't do that before. You know, you put the bone graft, you stretch the bone, the joint really jams, and once the joint jams and the bone heals, and then the patients go to move their toes. Sometimes they move really good because that patient is very flexible, but some of the patients, that jamming of the joint becomes an issue. So I have solved that problem now. For the past 3 surgeries, I have used my own created joint spacer. So I'm very happy to announce that. And so I'm constantly changing things and constantly making it better. Let's put it this way. Because it would be better. I'm listening to you guys. I see the feedback, and I'm also looking at my results and see what could I have done better. How can I do this better and quicker so the patient's out of the OR and more efficiently and consistent results. So those are the things I'm always looking at. So this procedure is still in that stage that I'm still modifying things. I think I'm pretty much there. Maybe 1 or 2 things that I'm still thinking about I could do better, but the results are speaking for themselves. And most of my patients recently that I've done this procedure on are very happy. So let's see how they're healing, and I'll keep you guys posted again. So I'm pretty much done. Let me see, is this one more? It was the second. We'll see if there's any. These are the last ones?
Yes, sir.
Okay, do you discount like being not a US citizen? I don't have insurance, so it's the cost possible to pay. I guess this thanks for this patient sending this, even though I think they probably use Google Translator. I really appreciate them trying to send me a question, and I'm trying to best understand, because normally many people in different countries don't have access to reach your hospital. So they're talking about if we can give them a discount because they're coming from a different country. We have placed those things in order. My patient care coordinator, Claudia, has all the information. I try to work with patients as much as I can. Honestly, trying to help patients is my goal. Obviously, we all have to make a living, but I try to work with them as much as I can. So yes, we are doing some of that. And I'm also probably soon we're going to be announcing some of these things that we have come up with. Maybe doing a lottery for a short toe lengthening for free. So we might be doing a lottery just to help patients out that cannot afford it or they don't have medical insurance. Same thing for my Amy Bunion procedure. We're going to be doing a lottery for that, maybe once a year or twice a year. We'll see how it goes. We'll post the results for patients who apply and try to get a lottery, so that way it's fair. Okay, so which we'll do that soon. So let me read this before it goes away. Which one looks better, bone graft or bone stage lengthening? Okay, that's a good question. They're both very much similar. You get the results, which means the metatarsal is lengthened at its maximum height. We cannot lengthen it more than the parabola. So every metatarsal has a height. So if your fourth metatarsal is short, is over here, we can only lengthen it up to here. I cannot lengthen it any longer. So most doctors pay attention to this curve. So the results are very similar. Just the journey is a little different. That's how I call it. So at the end of the day, they both function well. The patients are doing their normal activities. One has a little bigger scar. My new procedure, the bone stage, one stage lengthening, has a longer incision. The external fixation has less incisions, but it's multiple. There's like 6 of them. So 6 holes instead of a long incision. So most patients that I talk to, they don't really mind the incision, so that's not a big issue. There are some things that can go wrong with the bone one stage lengthening. There's something that can go wrong with the metatarsal lengthening. For example, if you don't put the fixator on the right way, once you start lengthening, by the time you're done, the bone is ending up over here or ending up over here. It's just basically going from here to Vegas, and you're off by like a millimeter. So by the time you get to Vegas, you're looks miles off, right? Or even lengthening when you put the fixator this way. If you're a little bit off, by the time you finish the lengthening, the toe ends up being down here, meaning the metatarsal. So that's been proven. That's one of the complications of metatarsal lengthening with external fixation. In the hands of an experienced doctor, it doesn't happen that often, but the complications are there. A lot of pin track infections throughout the thing. With the bone graft, the fact that the bone graft might not be healing, so that's one of the complications. So other complications are out there, but we'll do a segment on that. But which one looks better? They both look the same at the end of the day. Okay. Can you come to Bahrain or Dubai at least? I love this question. Of course. I mean, I would love to come there, but it's not that easy to just travel and operate on people. When you go to another country, you have to apply for their medical license. They have to allow you to open somebody up. You can't just come and say I'm a surgeon. So it's a process. Are we looking at it? For sure. I think that side of the world, there's not that many experienced surgeons doing this, like especially bone lengthening, metatarsal lengthening. So we're looking at it to see if we can pick a country and go there like maybe once a year and get all the patients lined up, and I'll be there for a week or two and operate on them and have a doctor there that can follow up for me, because it's not just like going and doing the surgery and leaving. These patients have to be followed up, x-rays taken, the complications can happen. So all those things I have to arrange for all those things. I'm not just gonna go there and, operate on someone and leave. So that's not me. So that is definitely something I'm looking at. If the demand is there, we'll definitely listen to it and act appropriately. So hopefully that happens. I haven't seen Dubai or Bahrain, so I would love to go see that place. Yeah, I'd like to. So, okay, that last question before. Oh, okay. So I have a Russian question, which is, I'm sorry, it's not Russian. I'm sorry. It's written in Russian, so I cannot read it, so I cannot answer it. But I appreciate that patient trying to ask us a question. Hopefully next time, if you can, please use maybe Google Translate, and it can translate for you, and you can send that to us, and I would be more than happy to answer your questions. Sorry, I cannot read it. All right, so go on to is that the last question? Yes. We have? Okay. So roughly how much do you charge for lengthening the short toe? So a lot of questions about the cost. So again, I have to see the x-ray, I have to see the foot, I have to see exactly what needs to be done before I can give you the price. If you don't have insurance, again, if you do have insurance, it's all covered. If you don't, then I would have to see all those. So you're more than welcome to contact my patient care coordinator, Claudia, which I will post the email address, so that way you guys can contact her, and then we'll go from there. And I'll promise you will get an answer. You just have to send the appropriate information, so that way we can send you at the best possible scenario price code that we can send you, because things can still change. It's never 100% when it comes to medicine. So I'm trying to right now type in our patient care coordinator email address, and I'll put it up here, so that way you guys can contact her. That's all she does. She doesn't do anything else. So she answers your questions pretty much every day, and all the new patients go to her, and she gets all the necessary information, such as x-rays, pictures, and questions that are submitted by that patient to me. Then I verify it, then give you guys an answer, and then we'll take it from there and give you the as best as we can accurate price code for the surgery. So here's our patient care coordinator's email address. It's patientcare@fixmyfoot.com. So patientcare@fixmyfoot.com is what you use to email your questions or your pictures and any other financial questions you want to ask her. She's there to answer your questions. I don't know, I think we're pretty much done here. This was my first live Instagram interview or podcast, however you want to call it. And I think it went really well, better than I expected. My guy over here, Sako, is managing my social media. He's managed this entire thing. Thank you, buddy. You've done a great job. He does all the editing for all the videos that you guys see. There's a lot of work that goes into it, trust me. Shooting the video in an operating room is not easy. So we had been successful because his experience and also setting up different cameras, sound, all that stuff. It's a tough job. And then he takes everything home and edits them, and then he comes and I have to approve. And I mean, there's a long process. The video you see that's like, what is it, 30 seconds, 40 seconds?
A minute and a half.
Minute and a half. A lot of work has gone into that, trust me. So thank you, I really appreciate it. And I'm gonna thank you on behalf of the patients who are seeing your videos, because I think that's just means a lot. When you see something and you see how the work is done, it makes you, familiar. And we don't like to be unfamiliar with something. We wanna familiar ourselves to the procedure that's gonna be happening. So that's very important, and that's what I'm trying to do, like give you guys a good picture of what will happen the day of surgery. So that way you feel more confident and more comfortable. So hopefully this segment has been received well by you guys. I love you guys. I thank you for following me. We'll mix it up a little more. Maybe we'll do some fun videos about other things besides work. But I do also have a channel that I post most of my personal stuff, which is the Life Limb Fitness channel. I've been into the fitness journey for the past 4 years, and I have completely transformed my body with diet and exercise. And so all that is on that channel. So that's why I call it the Life. So it's part how I live at home and the projects I do at home. Life, Limb, it's just my work, and then the fitness. So Life Limb Fitness by Dr. K. So that has a lot of information about other things that I do besides operating. So hopefully you can follow me over there and see everything that I do. Maybe we'll post that too. Give us a second, we'll post that so that way you can see exactly how it's spelled. It's basically Life Limb Fitness in one word. So please, there was one last question. Will the big horse off the floor still after surgery? So I think this patient is talking about, he's asking, okay. So he's asking, will the toe be elevated off the floor still after surgery? So, okay, here is my channel, Life Limb Fitness. Please follow me over there. You have a lot of fun, trust me. But to answer this last question before we go, they're talking about their toe is down after the lengthening, and it's like that probably. That's probably as a result of what we call the subluxation. So again, they lengthen your metatarsal, they did not pay attention to your toe to make sure the toe goes with the device. So they just lengthened this part and the toe started just either coming down or going up. I've seen patients, the toe goes up or down. That's as a result of jamming the joint. So that's the reason that happened to this patient or gentleman. So that can be fixed. We'll just have to do a segment on that, or just call us. We'll guide you through it. I'm putting out more videos to explain how those complications happen, so stay tuned. Those will be coming up. We just finished editing them, so you'll get your answer. Again, thank you guys. I love you, and I hope to do this again in about 30 days, right?
Yeah.
And this was fun, even though I can't see you guys, but I see all the waves, and I'm waving back. And thank you so much. Okay, we're gonna cut it from here, and see you soon. It says end now.
Mm-hmm.